Let's now shift our focus to India, where fears of the West Nile Fever outbreak have sent alarm bells ringing in the southern state of Kerala. What is the West Nile Fever? Why is it called that? And why has it become a cause of concern? Let me explain this. Earlier this week, one person died in the South Indian state of Kerala from a disease called the West Nile Fever. And in recent days, 6 other cases have been reported. Now, alarm bells are ringing. The health authorities in Kerala are on high alert. Authorities have ramped up pre-monsoon cleaning and are undertaking mosquito control efforts. Citizens have been told to stay vigilant and seek medical help in case they show signs of fever. So, what is the West Nile Fever? It's a viral infection transmitted primarily by mosquitoes. It is caused by the West Nile virus, commonly found in Africa, Europe, West Asia, and North America. Most people infected with the West Nile virus do not experience any symptoms. About 20% who get infected will develop fever. However, for some people, particularly the elderly, symptoms can range from mild flu-like symptoms like fever, headache, body ache, fatigue. More severe complications can include meningitis or encephalitis, which can lead to neurological damage or even death. And how is the disease transmitted? Transmission happens when mosquitoes infected from feeding on infected birds bite humans. The disease can also spread through blood transfusion from an infected mother to her child, or through exposure to the virus in laboratories. It's not known to spread by contact with infected humans or animals. According to the U.S. Centers for Disease Control and Prevention, the incubation period for West Nile fever disease is typically 2 to 6 days, but it can range from 2 to 14 days and can be several weeks in immunocompromised people. To date, no human-to-human transmission of the West Nile virus through casual contact has been documented. It usually turns fatal in persons with comorbidities and immunocompromised persons like transplant patients. But the death rate is relatively low when compared to Japanese encephalitis, which shows similar symptoms. Which brings me to the next question. Why is it called the West Nile virus? You see, in 1937, the virus was first isolated in a woman in the West Nile district of Uganda. In 1953, it was identified in birds in the Nile Delta region. Before 1997, it was not considered pathogenic for birds, but then a more virulent strain caused the deaths of different bird species in Israel. They presented signs of encephalitis and paralysis. In 1999, a strain believed to be one circulating in Israel and Tunisia reached New York. It produced a large outbreak that spread across the U.S. and it eventually spread across the Americas from Canada to Venezuela. So what is the cure for the West Nile virus disease? Currently, none. No West Nile virus specific prevention, treatment or vaccine is available. Only supportive treatments are given. Health authorities globally advise personal protective measures to reduce the risk of mosquito bites, like using mosquito repellents, for example. Public health departments, meanwhile, are encouraged to use larval source reduction, especially at breeding and resting sites for mosquito vectors. In most countries, the peak for the infections generally coincides with the period when mosquito vectors are most active and ambient temperature is sufficiently high for the virus multiplication. Since outbreaks in animals happen before that in human beings, animals are monitored closely to detect new cases. In Kerala, the health minister has suggested wearing clothing that completely covers the body, using mosquito nets and repellents regularly, and keeping one's home and surroundings clean. Are you someone who consumes protein supplements? or are you thinking of making them a part of your life? Then this story is for you. Over the past few years, dietary supplements have become quite popular. There are a series of protein powders out there. Now, the Indian Council of Medical Research has warned that protein powders marketed as protein supplements may contain added sugars, non-caloric sweeteners and additives, making them unviable for regular consumption. And keeping this in mind, ICMR has advised against the consumption of protein supplements to build body mass. As a precautionary measure, the ICMR has released the Revised Dietary Guidelines for Indians, or DGIS, taking a cautionary stance on the use of protein supplements by urging Indians to avoid their consumption. Led by the health research body, the National Institute of Nutrition in Hyderabad, these guidelines stem from a meticulous process involving extensive research. Among the 17 listed guidelines, a notable emphasis has been placed on avoiding the prolonged intake of protein powders or high protein concentrates, citing potential health risks like bone mineral loss and kidney damage. The ICMR has urged people to obtain good quality proteins and essential amino acids through natural sources rather than investing in protein supplements to build muscle mass. Research findings indicate that dietary protein supplementation is associated with only a small increase in muscle strength and size during prolonged resistance exercise training, or RET. Protein intake levels greater than 1.6 gram per kg a day do not contribute any further to RET-induced gains in muscle mass. As per the guidelines, adequate daily protein consumption can be achieved through a balanced diet containing protein from plant and animal sources. In fact, experts share that consuming pulses in a ratio of 3:1 or by substituting 30 grams of recommended level of pulses with 80 grams meat per day would improve protein quality for a normal person. On the other hand, it suggests plant-based protein-rich food sources include pulses such as green gram, horse gram, black gram, chickpeas, kidney beans, green peas, and one must also consider including nuts and seeds like walnuts, almonds, hazelnuts, chia seeds, pumpkin seeds, flax seeds, sesame seeds, and more. The research body also recommended restricting salt intake, minimizing sugar and ultra-processed foods, and reading the information on the food labels to make informed and healthy food choices. These guidelines are aimed towards achieving the National Nutrition Policy goals. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.